You're listening to episode 79, a 12-minute talk. How can I talk to my child about an upcoming surgery? Hello, everyone. I'm so glad you're here today for this quick little chat that gives parents an idea about how to talk with their child about surgery. This is a topic that is near and dear to my heart because one of my first jobs as a child life specialist was in a pediatric surgery center. It's actually where I met my husband, Preston. He is a nurse anesthetist. It's where I really got ingrained with the staff. Like, rather than being really close with my child life staff, I got really close with the pediatric surgeons and anesthesiologists and their pre-op and PACU nurses. And I just really love the group of people that take care of kids during surgery. So I'm so excited to jump into this topic. And I want to make sure that I'm giving you concise things to say so that you don't leave here feeling more confused than you started out. But I do want to start with just a little bit of child development, which is my MO of how we start these conversations, because you really need to apply what I'm saying to your child's age or developmental level. And then the other thing I'm going to tell you is that there is no wrong thing to say. If you feel like you are fumbling over your words when you are talking with your child, that is okay. Kids are incredibly resilient, and you can go back and say, hey, I didn't mean to say it in this way. I meant to say something else. So just know that children are very forgiving, and there's no wrong thing you're going to say. You're not going to make it any worse. Okay. So just have some confidence when you're walking into this type of conversation. So, child development, let's think about the timing for when to talk with your child about surgery. Younger kiddos, and let's just start at the toddler to preschool age, I really think they need about a day ahead of time before you start talking with them. It's not something you need to tell them 2 weeks every single day up until the moment of surgery. The day before, I would start planting seeds about tomorrow we're going to go see the doctor. And when we go see the doctor, here's what it's going to be like. And so you can kind of just start using words that they're going to be hearing. I love play, of course. I'm a child life specialist. So this is really when I think jumping into medical play, either with a doll, even if it's a pretend medical play kit, that's okay. Or if you're watching Daniel Tiger and there's a going for surgery episode, or, get on YouTube and do a little bit of research yourself and just start kind of immersing your child into the surgical world and just start saying, surgery is when the doctor fixes a part of your body that needs to be fixed or needs to help a part of your body. That's the big thing for toddlers and preschools is just play, just being present and supportive. One of the big tricks and hardest parts about surgery is not being able to eat ahead of time. And that's really, really tricky when you have a hungry, hangry toddler. So if you can, see if you can get surgery at the very beginning of the day. Of course, emergencies pop up at hospitals. There are delays. There are a million things that can cause your wait time to extend. So the earlier you have your surgery, the less amount of time that your child will have to be hangry. Personal experience, my daughter had an MRI when she was 2 years old with anesthesia, and we did not have that MRI until 2 p.m. She was not allowed to eat or drink anything. So I know the pain of having a hangry toddler. And it's not easy, but you can get through it. It's actually a little bit easier than you expect because the whole experience for the child is just so new that they're not thinking about food in their normal routine, right? They're not spending time in their kitchen, not being able to eat. They're actually out and about trying to find something. So that was one of the things I did is we weren't even able to go into the hospital until about 10:30 or 11. So that morning we went out and just went for a walk and then did sidewalk chalk, whatever I could do just to help keep her entertained before she realized how hungry and thirsty she actually was. Another practice that you can do even with kids that are young toddlers and preschool, and of course this applies to older kids too, is packing a bag the night before surgery with some fun items to help keep them entertained and comfortable. So, yeah, I'm saying bring the iPad for sure, bring the iPad charger. Let's bring like a comfortable stuffed animal or blanket or something that is familiar, maybe a book, stickers. Whatever can keep their hands and their minds busy is going to help in the long run when you're there. The other thing, packing a bag with them the night before, is when you're getting up that morning, you can say to them, "Oh, let's go get that bag you packed. You know exactly what you're going to bring." So you're taking away some of that fear of the unknown about what's going to be happening that day because they already have a whole bag full of materials that they know what's in it. As a child life specialist who has worked with hundreds of children and families over the past decade, I know that no two children are the same. That means I need access to tools that can easily adapt to whatever situation I'm in. SmileMakers has thousands of unique items that help me navigate every scenario, whether I'm looking for stickers and prizes for goodie bags for my patients or even my own kids, or I'm in child life specialist mode, working clinically to help a child cope with a medical procedure. I'm happy to support SmileMakers because they are a company who prioritizes the mental and emotional well-being of children by offering smiles on every page. Head to smilemakers.com when you're looking for a tool, toy, or prize to help a child smile. Use code ONCALL20 for 20% off your order of smile-making stickers, toys, patient supplies, and more. So moving on to school agers, I really think it's a good idea to start the conversation at least a few days ahead of time. Most likely, if you have a school ager, they know that they're going to have surgery. So the more you put it off and don't talk about it, the more questions they're going to start to develop in their head. So actually getting the conversation out ahead of time is really helpful. You don't have to go into grave detail the first time you chat, but you can let them know, hey, we've got a surgery coming up next week. It's going to be on Thursday. We're going to have to miss school. I don't know all of the details about timing yet, but as soon as I do, I'll let you know. So you're kind of just opening up the communication and allowing them to start processing about what's going to happen. So the day before surgery or a day or two before surgery, I would start the conversation that gets into more details about what they're going to be experiencing and why they're having the surgery. Whatever the surgery is going to be, start talking about the why it needs to happen. And you don't have to get really specific about the tools and equipment and everything that's going to be used in the room when the surgery is happening, but you do want to chase the why it's happening so that your child can understand that this is something that's not negotiable. It's not something that we get to get out of. It's really important for their body. I would recommend getting on a hospital or surgical center's website and see if they have any pictures. And they also may have some information about what the process is like. So if you, as the parent, do a little bit of research ahead of time, you'll be able to find out a lot of information about maybe what the check-in process is like. Will you have to wear a hospital ID bracelet? And these are details that you can tell your child so that when they get there on surgery that day, they know what to look for. The big question for a lot of kids is, do I have to get a shot? Am I going to feel anything? Is it going to hurt? So I think it's important to address these questions up front. Am I going to have to get a shot? Well, you can answer and say, I don't know. I'm going to find out everything I can ahead of time, but we may not know until we get there. If you did have to get a shot, the reason it would be is you would have to get an IV for the anesthesia medicine. The anesthesia medicine is the medicine that makes you sleep during the surgery so you don't feel anything. And when you wake up, you're all done getting the anesthesia. So that's what makes you wake up. So the anesthesia is an important part of getting the surgery because we don't want you to feel anything. Sometimes they let kids breathe in a mask to get the anesthesia, but sometimes you do have to get a shot through an IV. We'll find out tomorrow, but no matter what's going to happen, I'm going to make sure you know exactly what the details are. So we're answering the question honestly. You're allowed to say that you don't know, But you're also allowed to let them know the truth. So I'm going to give you a little scenario about, I had a patient once, I think he was about 8, and he was coming in for a circumcision. And that's a pretty old age to be getting a circumcision. And I can't remember, the details, and actually it's not important about why he was getting it at that time. But he was coming in for surgery and he was under the impression that he was there to get his leg fixed. And, he came in with his dad. And so I pulled his dad aside and I said, well, what does he think is wrong with his leg? And he's like, well, no, I didn't want to tell him. And, I totally get that. I get that it is scary to have your child understand that they're going to have a painful procedure done. But when you tell them that they're going to get their leg fixed, it sends the wrong message about something that's not actually going to happen. And then that doesn't help build trust. So why in the short term, it may be the easier answer to just say something kind of general. It's actually going to do more damage. To kind of wrap up that story for you so you know how it ended, we just ended up talking with the dad about why it's important to be really honest, especially in a private area like that. We want to make sure that when he wakes up after a circumcision, he knows that what happened was on purpose and for a medical reason, that he was in a really safe place. The dad, of course, eventually got it after we talked and was all about being honest with him. He just didn't know the words to say. I think as parents, we can jump really quickly to saying, and then it'll be so much better and you'll be all done. But the truth is, after surgery, you really don't feel all that great, right? You kind of feel either sore from where the incisions happened, or you feel like crap from anesthesia and you've been vomiting. So it's okay to say right after you wake up, we're going to get mom and dad to be with you, and we're going to help keep taking care of you and making sure you get the medicine that you need to get. So we want to be honest, right? They're not going to wake up feeling great. Some kids do, some kids don't. We don't know how your specific child is going to react. Guys, I feel like I could just keep on talking about this topic. So the last thing I'm going to tell you is that I think it's a good idea to have your child write down questions ahead of time to bring in. And that means, yes, physically sitting down at the kitchen table and having them write out their thoughts, because the misconceptions in their head and their unknowns and their fears are not going to be addressed if they keep them inside. And the more they're able to get them out and have them answered, the better they'll be able to have with the experience. So I hope this was helpful. If you have a child that is going to be having surgery, at Child Life on Call, we love giving specific surgery consults. So if that's something that you would like for your child, head on over to childlifeoncall.com and you can sign up and we can get you set up with a virtual session with a child life specialist. All right, guys, I hope you have a great rest of your day. I will see you next week with another parent episode. All right, bye. Thank you for listening to the Child Life on Call podcast. I'm your host, Katie Taylor, and you can follow us at Child Life on Call on Facebook, Twitter, and Instagram. Please rate and review to make it easier for other families to find us. We have cute merch available at www.bonfire.com/store/childlifeoncall, and you can listen to more episodes and find resources at childlifepodcast.com.